Om Tham Dhanvantare Namaha. Karpuragauram Karunavataram Samsarasaram Bhujagendraharam Sadavasantam Hridayaravinде Bhavam Bhavanim Saitam Namami. Let me share. Today's topic is study on cutaneous leishmaniasis. Leishmania Donovani infection causes Kala-Azar, chronic fever condition, and the leishmaniasis can also occur in skin. So that is known as cutaneous leishmaniasis. The parasite is going through the blood and reaches the skin, produces the skin lesions, macules, papules, nodules, ulceration, and chronic inflammation occurs in cutaneous leishmaniasis. So this is a patient of cutaneous leishmaniasis. Cutaneous leishmaniasis is the most common form of leishmaniasis affecting humans. It is a skin infection caused by a single cell parasite that is transmitted by the bite of a phlebotomin sandfly. There are about 30 species of leishmania that may cause cutaneous leishmaniasis. This disease is considered to be zoonosis on an infectious disease that is naturally transmissible from animals to humans, with the exception of Leishmania tropica, which is often an anthropootic disease, an infectious disease that is naturally transmissible from humans to vertebrate animals. Post-Kala-Azar dermal leishmaniasis. Post-Kala-Azar dermal leishmaniasis is a recurrence of Kala-Azar that may appear on the skin of affected individuals months and up to 20 years after being partially treated, untreated, or even in those considered adequately treated. In Sudan, they can be demonstrated in up to 60% of treated cases. They manifest as hypopigmented skin lesions such as macules, papules, nodules, or facial redness. Though any organism causing Kala-Azar can lead to PKDL, it is commonly associated with Leishmania donovani, which gives different disease patterns in India and Sudan. The Indian variant, nodules enlarge with time form flakes, but rarely ulcerate. But nodules from the African variety often ulcerate as they progress. Nerve involvement is common in African variety, but rare in Indian subcontinent. Histology demonstrates a mixture of chronic inflammatory cells. There can be macrophage or epithelioid granuloma. Parasite concentration is not consistent among studies, perhaps reflecting low intensity of diagnostic methods used in earlier entries. Promastigoes of Leishmania are transmitted to the skin by the bite of a sandfly. Leishmania then invades human macrophages and replicates intracellularly. Raised red lesions develop at the site of the bite, often weeks or sometimes years afterwards. The lesion then ulcerates and may become secondarily infected with bacteria in many species. For example, Leishmania major. The lesion often spontaneously heals and heals with atrophic scarring. In some species, for example, Leishmania bredlensis, the, this may spontaneously heal with scarring, but then reappear elsewhere, especially as destructive mucocutaneous lesions. Lesions of other Leishmania species may spontaneously heal and then reappear as satellite lesions around the site of the original lesion or along the route of lymphatic drainage. See the lesion of the cutaneous leishmaniasis. There is the raised area, central ulceration is there, secondary infection is there, chronic inflammation. The sandfly is responsible for the transmittable disease. This is a lesion of leishmaniasis, cutaneous leishmaniasis. You can see raised lesion. It's also cutaneous leishmaniasis. That is nodules are there, inflammatory reactions, chronic inflammatory reaction in the skin is same. It's also case of cutaneous leishmaniasis. You can see the reddened area, chronic inflammation. There are nodules also. The other patient with the cutaneous leishmaniasis, you can see the ulceration, reddened area, inflammation. This is the blood, you can see the Leishmania pneumoniae, the parasite. There are two types, promiscuous and you can see the parasite. Parasites. First rate, you can see the parasite. Yeah. Erythema form and hyperkeratosis, vascular structures, and erythema or ulceration is seen, and large border is seen. In the Sudan, you can see the disease has not 3% of leishmaniasis. In leishmaniasis is the Sudan is a very backward area, underdeveloped. The people are affected by leishmaniasis. So the fly can bite and cause leishmaniasis. You can see promasticos and amasticos. Amasticos. Skin, you can see the lesion, cutaneous leishmaniasis. We see under microscope, you can see the amasticos. Promasticos. Amasticos. Yes, initially the redness or the chronic inflammation than the ulceration. You can see the sandfly bites and disease spreads from the animals to the human being. This is the structure of Leishmania. Single cell animal. The reaction is seen in the skin. The disease spreads. You can see chromasticus and demasticus. Leishmania. The blood stream, the parasite is same along with the herbaceous. Sand fly is responsible for transmission of disease from animals to human beings. So today we have discussed cutaneous leishmaniasis. Actually, Leishmania donovani, which is responsible for Kala Azar. In the Bihar area, usually the Kala Jara is there. We can give an antimony compounds can be given in Kala Azar, which is effective. The disease Kala Azar will be characterized by new features, fever, high-grade fever, splenomegaly, hepatomegaly, ascites, emaciation, skin discoloration, etc. Same in Salazar. The leishmaniasis can also cause the cutaneous manifestation, is cutaneous Salazar. We can give antimony compounds, also we can give Rosamanicchia, regular genuity, and Pratikadi Kashaya, Patola Patoranya Kashaya, Amanjichat Kashaya. So, it is a chronic disease which needs prolonged treatment. The rare disease, the rare disease, is a rare disease, not same in India. So thank you for patience.